Good morning.
Good morning.
I'm pleased to introduce you Professor Albert Bensman, former head of the Department of Pediatric Nephrology at Children's Hospital Trousseau in Paris, France. So, good morning. Could you please tell me a little about your career?
Okay, so in fact, the career in pediatric nephrology began in 1977. At this time, the head of the Department of Pediatric in the Trousseau Hospital wanted to create a department of pediatric nephrology. And the rationale of this decision was that in Trousseau Hospital there was a huge department of pediatric urology. And of course, all these children had a lot of problems due to their congenital abnormality of the kidney and the urinary tract, and a lot of urinary tract infections which were not treated with rationale. So the first aim was to treat with rationality this urinary tract infection, and then to manage all the nephrologic problems of these children. So what was amazing is that I was very young, only 32, and everything had to be created. It was the first renal biopsy, the first hemodialysis, the first peritoneal dialysis. So everything had to be created. And because I was very young, the whole staff was very young, and there was a kind of atmosphere of startup because everybody was young, sometimes very naive. But we were very lucky also because on the other side of the Seine, there was, of course, a prestigious department with Michel Broyer, René Habib, and of course, we had to follow their advices and their practice.
What were your research themes?
So at the beginning, it was urinary tract infection, and we, with Dr. Desnottes, we had experimental models in rabbits of experimental pyelonephritis, how to treat them, and what were the consequences of this pyelonephritis in animals. But then this was the only fundamental research we could perform within Hôpital Trousseau because there was no research department. So then we worked with other hospitals and mainly with the Department of Adult Nephrology in Hôpital Tenon, which was headed by Professor Gabriel Richet. And then we studied, for instance, the prostaglandin development in the glomeruli according to the age of the rats. And then, of course, we worked with the doctor, Professor Pierre Roncaud, and which led to publication in the New England dealing with a new cause of membranous glomerulonephritis in neonates due to a defect of endopeptidase, neutral endopeptidase in the mother.
And do you have any souvenirs to share of ESPN meetings?
Yes, in fact, the first impression was that I was very impressed because I was very young, very naive, and in front of me I had the founders of pediatric nephrology. And of course, at the beginning, I was very impressed by Michel Broyer, René Habib, Martin Baratz, Dillon, and so on. And so I was very anxious when I had to make a presentation in front of these prestigious people. And little by little, I became old myself, so I was less impressed.
And what advice do you have for the next generation?
Yes, okay. I think that one of the main characteristics of myself and my group was enthusiasm. And because we were so enthusiastic, we didn't count our time. we didn't count the number of hours we were in the hospital. Maybe it was too much, but this was our goal. And I found a huge difference between my period and the nowadays period, is that now the main people in the hospital are the administrative and not the physicians. And I think that this shouldn't be accepted, and they should understand that, of course, they need enthusiasm, but a hospital is mainly a place where physicians treat patients. And I think that these two people should be the head of the hospital and not the administrative.
Thank you very much, Professor Bensman.